Hi, I'm Eric with Ultramax Sports and talking to you today about IT band syndrome. This is probably one of the more common types of pain we see when people come into our store. And so there's a lot of misinformation out there, so we're going to tell you a little bit about it today. The IT band is a thickening of tissue, of fascial tissue. So fascia is a supportive structure, it's collagen, it's kind of like a rope. It doesn't stretch, and it surrounds your muscles. And so the fascia surrounding the thigh muscle has a thickening on the outer edge, and so that is what we refer to as the IT band. And so it attaches at the top. Primarily the thickened part attaches with the tensor fascia lata muscle on the front of the hip, and the gluteus maximus and a little bit of the gluteus minimus on the rear side. And down below, it attaches to this little bony prominence at the top of your tibia. And so most people feel like, if you read online, that the pain, normally the pain is on the outer edge of your knee, is from a tightening of the IT band and then rubbing over the outer edge of the knee. We're pretty sure that that's wrong now. In about the last 10 years, there's been a lot of research out, and so we're proving that it's actually not tight. It's not what causes the pain. It's actually not even your IT band that is the source of the pain. It's probably the tissues underneath it, some highly innervated tissues. But regardless, typical treatment protocol that are often recommended by medical professionals these days and online is stretching the IT band. So number one, that is an improper way to treat it because it's collagen. It doesn't stretch. There's going to be no benefit to stretching that muscle, that tissue. Another one often used is rolling on a foam roller. Now, it does feel pretty good, but you're not really addressing the foam roller when you roll on that. You're really addressing the thigh muscles. And so really the best way to approach IT band tendinitis or IT band syndrome pain is by addressing the muscles that attach on the top. And so this tensor fascia lata and the glute maximus. And so that's going to be best approached by hitting the trigger points. So finding the really tight sore spot and laying on a tennis ball or a hard ball of some sort. Now you can do that with the foam roller as well, but you can pinpoint that area a little bit better with the ball. So that's just laying on the floor, putting this between you and the ground, finding where it hurts, and letting it sit in there for 30 to 60 seconds, as long as it takes to release. It's not that the muscle is tight because the muscle's tight. It's really a central nervous system thing. Your muscle, your brain is telling your muscle to stay tight, so this kind of resets the central nervous system and tells it to relax. So that's probably the most effective way to treat the symptoms of IT band syndrome. Because we know that it's collagen. Collagen does not get inflamed, and so there's no inflammation in there. It's really not a tendinitis at all. So it do you no good to take anti-inflammatories in almost all cases of it. Now, there are some surgeries they'll release your tendon, your IT band tendon, and they'll make a little snip in the lower end of it, and that gives it a little bit more of a stretch, and that'll help relieve the pain. It's really not a first case option for most people. The root cause of IT band syndrome is almost always some sort of a muscle imbalance. I've never seen a customer with it on both sides at the same time. If it was, then we would suspect some sort of foot issue, shoe issue, training issue, something like that. Whereas most of the time it's on one side, and so it's almost always an imbalance of some sort or a compensation going on. So maybe you hurt your calf last year, and now you're running a little bit differently, and so it puts a little bit more stress on this side of the body, and you feel it in your outside of your knee. And so it's one of the more tricky pains to solve because we have a pretty complicated pattern of compensation in most injuries. And so finding a sports medicine professional that is good at evaluating from hip to foot or even higher is going to be the key to solving IT band pain.